Good morning, everyone. I am KP George, Fort Bend County Judge. This morning, I appreciate that you all here, and we have some important information to share with you all regarding COVID vaccine distribution in Fort Bend County. And it is a hot topic these days. We discuss all over the country, maybe all over the world, as a matter of fact. And I just want you to know that those who are listening to me, I am as frustrated as you are. And one of the challenge we are facing is not having enough vaccine available. And as you all know, I compare that to very much similar to what we faced in the 2020 March, April time when it comes to the test availability. We always had a problem. So I think it all will get better. Unfortunately, the state and also the federal government is in charge of that distribution, and I'm hoping things will get better, and things will get better. That's what I'm seeing. And meantime, what we do is what we have in control in Fort Bend County, and we are prepared to receive hundreds and thousands of vaccine and administer in a timely fashion in Fort Bend County. And I wanted to thank Health and Human Services Department in Fort Bend County under the leadership of Dr. Jacqueline Minter. You're going to be listening to her soon. Did an amazing job in setting up and hiring people and training them and vaccinating them. And we have staff available. We have deep freezers available to freeze the Pfizer vaccine. And we are ready to give out thousands of vaccine possibly a day. And so we are, as a matter of fact, we all know that maybe. Today we will be receiving another shipment. I don't know exact how many vaccine that going to be, but a considerable amount, I'm hoping. And also, one of the good thing meantime happened is the state designated Fort Bend County as a hub, vaccine distribution hub, and which means we could receive larger quantities of vaccine and distribute to our citizens in Fort Bend County. And we are identified places, different locations in Fort Bend County as and when we need it. And we will be having numerous locations. And at the moment, we don't have an exact address or information available to disclose. But I just wanted to say, we are moving forward, and definitely the hope is in the horizon, and that is here, not in the horizon, right? It is trickling in. And also I just wanted to say, once we get this shipment today, we have 5,000 people registered to get vaccine administered, and they will be contacted momentarily. And I just want our citizens to say, please be patient, and we have to reach out to 5,000 people. We will get it to you. And also sometime today, Dr. Minter will discuss that more. We will open up further registration on our website, which is called fbchealth.org. And we will be registering more people to get vaccinated. But remember, you have to register to get vaccinated. That actually help all of us to administer this in an orderly fashion. And also, when you registered, when your turn comes, you will be contacted, and you will be communicated with a time and also a location where you can get your vaccine. And my bottom line message to our citizens: we are working hard behind the scene, and also things are moving, and please be patient. And now I just wanted to bring up a person who worked so hard more than a year behind the scene every single day without any rest, or I should say you work 7 days a week, Dr. Minter. And so I just wanted to say thank you for her leadership. Thank you for the good work is happening in Fort Bend County. I wanted to introduce Dr. Jacqueline Minter, our HHS director. Doctor.
Thank you, Judge, and good morning, everyone. As the judge has said, There's definitely frustration. There's frustration because it's a pandemic, so we're going to be frustrated. We've been kind of on edge for the past 12 months, and now we're coming to the end. It may be a very long end. There are going to be mistakes that are going to happen. There are going to be further hurdles for us to go over and to reach. But we're so excited to be able to be in the vaccination process now that will get us closer to the end of this pandemic. One of the things that frustrates the public the most is the inability for the supply to meet the demand. The inability of the supply to meet the demand. And so we understand that. We're in phase 1 of vaccine distribution right now. And because we're in phase 1, there's limited supply. The supply will get broader and we will be able to vaccinate more. But right now, the supply is limited. Fort Bend County is fortunate enough to be named a hub. And that means that we are working very hard to make sure that when the vaccine arrives, it is anticipated here today, but we have not received it. And so until it arrives and until we check and make sure that the quality is good, we will not open up for any appointments. That would just not be a good thing. So we want to make sure that we see that the vaccine's actually in our possession and that it's good vaccine before we open up for appointments. And then, as the judge mentioned, we will also open up for further pre-registration so that once those people move off the list, they're scheduled to get their vaccine, then we can also populate that list with more people. I'd like to bring up Barbara Martinez. Barbara Martinez is our Clinical Health Services Director, and she is leading the immunization effort for the county. She also is fluent in Spanish, and she is going to reiterate the comments that the judge made and that I just made in Spanish. Barbara?
Para nuestros amigos de habla hispana, voy a darle un pequeño sumario de qué fue lo que dijo el juez y qué fue lo que ha dicho la doctora Minter. Todos entendemos que nuestro público estará frustrado porque la demanda de la vacuna es muchísima más alta que el número de vacunas que hasta ahora nos han podido dar. El juez está con ustedes, entiende su frustración, entiende que queremos dar las vacunas y apenas nos lleguen, vamos a poder administrar la vacuna a la gente necesaria. Ya tenemos más de 5,000 personas en una lista de espera. Esas 5,000 personas van a ser contactadas primero y después, más tarde, cuando nos aseguremos que la vacuna llega intacta, que la vacuna está en buena calidad, que no haya ningún problema con la vacuna, vamos entonces a volver a abrir el registro para que más personas se puedan inscribir para recibir su vacuna. Es importante que por favor se inscriban y nosotros los vamos a llamar con una cita para que vengan a ponerse la vacuna. Otra vez, todos estamos con ustedes, entendemos la frustración, pero tenemos esperanza de que todo esto va a mejorar a como vamos avanzando y los números de la vacuna, la distribución se mejora a un nivel federal y un nivel estatal. Por ahora lo único que el Fort Bend County puede hacer es administrar las vacunas como nos llegan. Le voy a dar el micrófono al señor juez.
Yes, but you wanted to give and
Is there something else I left?
no,
I think I summarized it.
okay, already.
Yes, sir.
Thank you, thank you. And thank you, Barbara. Appreciate all your hard work. And like I said, I reiterate one more time, the light is definitely at the end of the tunnel. And I just wanted to say, also work with us, be patient with us. And we are every single day, we are working hard to make this happen, make it available to each and every one of you. And also understand it is important when the vaccine is available, you get vaccinated, because if you don't get a large number of people get vaccinated, you all know that the herd immunity is not going to happen. And also you got vaccinated doesn't mean you don't have to wear a mask anymore, or we have to follow all the tools We are under an emergency situation. We all know that. And, we are under maybe one of the longest emergency situation we are dealing with. And let's work together and let's wear the mask. Follow all the CDC guidelines. Think about your family. Think about the people. In your family and also your community. And we all have citizens of Fort Bend County, citizens of Texas, citizens of this great country. We have a responsibility towards the people around us. And so please wear masks and, exercise all sanitary conditions and avoid large gathering. And please avoid large gathering, because the reason I say that, if you look at our Fort Bend County hub, we have more than 40,000 positive cases and a little over 30,000 recovered cases. That means around close to 10,000 people have active COVID infection in Fort Bend County. They are that we know of. And so that means, 2 months ago, it was only like maybe 1,000 to 1,500. That shows there is a lot of people infected out there in Fort Bend County I'm talking about. And so please exercise all the CDC guidelines. And so together, we will beat this pandemic and we will get back to normal life. But we need your help to help. And we need your help to help you. I mean, to work with you and, make this community a better place. With that, I will conclude here. If you have any questions, we can entertain at this point.
So if you don't know exactly how many doses of the vaccine is coming, is that correct?
That is correct.
When
Yeah.
will you know that number?
Dr. Minter, please go ahead.
Yeah, I don't know who that's a question for.
Oh, no, that's okay. Yeah, that's a great question. So what happens, we find out the number of doses that we were allocated. And so we were allocated, as public knowledge, we were allocated 5850 doses. Of those doses, until they arrive, we don't know exactly what we're going to get, but we're planning for that. So that's the allocation that Fort Bend County was allocated.
So you might not get all 5,800 at once. You're just
They're in two different shipments.
Oh.
They tell us when we expect them, but until they arrive, I think everybody's familiar with the fact that sometimes packages don't come the way they're supposed to. So, but we're anticipating that they arrive sometime very, very soon, hopefully today, and then we'll be, once we make sure everything is fine, then we'll make sure that we are registering people and making appointments.
So it's not for sure today. You said hopefully today. I just want to make sure we're letting people know. You hope today is the first shipment.
So they have told us that it's going to arrive today.
Okay, perfect. Thank you.
Mm-hmm.
And Dr. Minter, just to clarify that this disbursement that you will be receiving is meant for the people who have already pre-registered, right?
That's correct. So there's a group of people that have already been on the waiting list, and they registered the first time, so they pre-registered, and so for that group of people, they are in line to be scheduled first. Okay,
So
so
is this allotment, this shipment already spoken for?
so it depends on what comes, but yes, it could be completely spoken for. It could be, yes,
Do you know how many people are pre-registered?
over 5,000 people.
Oh, wow. Okay, sorry.
And you mentioned you're going to open up further pre-registration.
We-
Do we know when that will happen?
We won't do that until, again, we know that we're opening up and starting to schedule. As soon as we're starting to schedule, we'll know people are moving off the list. That's just the way we're going to do it.
Do you see other counties nearby
Mhm.
having gotten these vaccines, rolling out thousands, vaccinating thousands of people? Do you feel a little left behind? Like, hey, what about us in Fort Bend? I mean, you talked about how it's frustrating a little bit. Just speak to that.
So I understand how frustrating it can be for the public, but we also understand that this plan was not ours. This plan was laid out at the federal level. And so because we knew the plan was laid out at the federal level, we assumed that our role would be smaller and that the allocation would not be a lot at once. It takes time to ramp things up. And we understand that the public wants time is, I waited an hour, I waited a week. Time for the plan was that there was not going to be a lot of vaccine until the end of January 2021. So that's kind of where we are now. We know that sometimes plans change, things change. So we would love to have it. We feel the public's frustration, but this was a federal plan. It was not our plan. They rolled it out, and we have to abide by it.
And we know it's definitely a fluid situation, like you said, everybody's waiting, everybody is being patient. What would you tell to folks who are maybe waiting at home, who want to register, what would you tell them, I guess, at this point, what their game plan should be going forward, as to when they should register, what they should be doing in the meantime that they haven't been able to?
Sure. So I think they should be doing what they were doing before, making sure that they are distancing, washing their hands, keeping their masks on, knowing that there will be more vaccine coming in the future. Their turn will come, keeping their eyes open and their ears open and looking for all the information that they need. Just make sure that you're ready, that you stay informed. And we love it. We're so encouraged that everyone wants to get this vaccine so that we can get out of this pandemic. Thank you.
Can I just ask one last question for the doctor?
Yeah, doctor. One more question.
I'm sorry, just really quickly. It's just interesting, you know, you're a doctor and you deal with these families who've been torn apart and affected by this virus. And you said so well explaining how it is a federal plan. What would you say to the people who are just like, I still hate, you know, I'm frustrated with this plan. I see people in Houston get, like, can you empathize a little bit with it? We just want to.
See, I might be able to answer
Sure.
that.
I mean, I
I
could.
just, as for
Yeah, yeah.
From a physician's point of view, of course.
Yeah.
Of course, I can empathize with that. We would love, as I think I've mentioned before, and maybe not on in this forum, but absolutely, we empathize with every one of them. We see daily what goes on. We see the deaths. We see families that are suffering. If we could wave a magic wand, Barbara's a nurse practitioner, if we could wave a magic wand and have everybody just healed today and protected today, we would. But this is the way that the process occurs, and we will move forward. Thank you.
Yeah. And also, I just wanted to add, there is no incentive for people like us not to work with every resources available to bring this vaccine. What is the best thing we can do to our citizen or give it to our citizen is telling them there is vaccine available. And one more thing I wanted to mention, we very closely worked with our state legislatures, like our state representative and state senators, and also our congressmen. And so I believe they worked behind the scene to make this Fort Bend County a hub, approval. So I just wanted to thank them for that. And so one more thing I'm telling our citizens, we are using every resources available to speed up this process. And we will continue to do that. And we completely understand your frustration. And I get calls. It is heartbreaking. People saying my mom is 85 and she's sick, and I saved her this far. Can I get a vaccine? I'd love to give her a vaccine. And but the unfortunate fact is we don't have it available, but that situation is changing. As of now, it is changing. And the approval as a hub is going to be bringing more vaccine. As you know, we only had 1,000 vaccine we got in the past, all this time. So things will get better. And if you don't have any further question, I will, yes, sir.
Where are you going to set up the hub? What's the plan for that?
That is something not 100% decided. Right now, we have one location at Fairground, right? And so we will be announcing that based on the need, because we don't know actually exactly where is that big need. And also we plan to open at least 3-4 locations we identified. But the reason we don't want to announce it, because we really don't know. First of all, we don't have enough vaccine. And second, we don't know where the actual needs are. So we are staying flexible. So we see if certain place need one, and we have that flexibility to add one there. So Fort Bend County is ready to act on it, and so we are waiting to receive the vaccine and move forward. And also, once again, go to our website, fbchealth.org, and when it open, get registered. And once again, looking forward to working with you all. Please help us to help you. Thank you.